Welcome to Periop Talk. I'm Jake Runyon with AORN Center for Perioperative Leadership. As a nurse and a dad, today's episode really hits home. We're talking about childhood anxiety in the OR and how periop nurses can help calm their young patients, and in some cases, the parents too. I empathize with the child, the fear of unfamiliar surroundings, bright lights, medical equipment, a lot of people moving about, and the uncertainty of what lies ahead. And I empathize with the nurse, navigating the medical and emotional landscape to both assist in a safe surgery and understand the big feelings the child is experiencing. That's why it's so important for periop nurses to understand childhood anxiety and gain some practical strategies to combat it. So excited to have Tammy Hanks back with us here on Periop Talk. Tammy, you recently wrote a piece on this in the AORN Journal, and I know you have over a decade of experience working with pediatric patients in the surgical setting. So I want to start by just talking through some of the common ways children might express anxiety before surgery.
Yeah, so a lot of that is age dependent. You can see anything from a newborn through 18, and sometimes even older than that could be considered a child when you're looking at behavioral delays or things like that. So, when you have an infant, they're really going to be showing anxiety by being clingy, by not having that trust in their caregiver like they do with their parent, wanting their mom to hold them, or their caregiver, whoever is there with them. In your toddlers, you're going to see similar things where they see a stranger walk in the room and they want to know, who are you? What are you doing? Are you going to touch me? Is it going to hurt? They really want to have those choices. And I think as nurses, we often forget you don't give a child a choice that's not acceptable. So it's really important when you're approaching children to offer choices, give them some sort of control in a very uncontrollable situation, but make sure that those choices are acceptable. Don't say, do you want to come with me? Because they have to come with you. And that can create a ton of anxiety for a kid if they think, oh, I'm being given a choice and I say no, but you take me anyway. And then obviously your older school age and adolescent children are very concerned with what it's going to look like after surgery. Are they going to be, are they going to have a scar? So explaining those things like you're going to wake up with a bandage, or, I'm going to take you back into a room that looks really, really blue. Just using that age appropriate language. And then of course, making sure that you're talking to the kids and not just the parent. Because I think, for nurses who are used to working with adults, they walk in a room and they gravitate towards that adult and say, hey, I'm your nurse today. It's really good to do that at the beginning when you have a child in the room to build that trust so they can see, oh, my mom, my dad, my caregiver, they trust the nurse. But then turn your attention to the child and make them part of that conversation.
Yeah, it's interesting you say that, Tammy, because I've been on both sides as a nurse and then again as a parent. And as a nurse, I was kind of guilty of that, right? Talking to the parents, especially on those younger kids.
Yeah.
And then being on the other side, you can really feel, right? These kids are smart, right? And so even those toddlers all the way up, like you mentioned, they know what's about to happen and they're also able to communicate. So speak a little bit more about that teenage, you've cared for the whole spectrum. Talked about so it's more the post-surgery, like what's gonna happen after surgery. Is that correct?
It can't be. We have to give enough information ahead of time for those older kids. A lot of times, if you have the ability to give a tour, many of them are curious of what's the OR going to look like. All they've seen is, TV shows that show some really scary things. They often want to know, am I going to wake up during surgery? So the words that you use are very important when you say, go to sleep. To them, that could mean normal sleep, like bedtime sleep. You need to be clear in your language depending on their age. You're going to go under general anesthesia would be appropriate for an older, for your adolescents to say, you're not going to wake up during surgery. The anesthesiologist's job is to make sure that you stay under general anesthesia. You have to build trust. And so that often means using the right words at the right time, giving enough information, and not just dismissing fears. If a child tells you, I'm scared or this or that, acknowledge those fears and say, I understand you're scared. It's very scary. Here's what you're going to see. Here's what you're going to feel. Here's what you're going to smell. The lights are going to be bright, or you might see some faces looking down at you with masks on. It's a very intimidating environment for a kid when just imagine what that looks like to you as an adult if you've ever had people standing over you and staring. So really just understanding those different age developmental ranges and what kind of information both the child and the caregiver need to make sure that those anxieties are alleviated.
That's a really good way to start, because is mostly an adult perioperative nurse and then floating to pediatrics. You literally might go from a 2-year-old to a 14-year-old, right? And so I appreciate you calling that out. So the age appropriateness is very important. And this might be more for the younger, even younger patient, that toddler to like maybe a 6-7-year-old. But are there any other resources or tools that you recommend or you've used that might help children cope with their anxiety?
Yeah, coming from my experiences was in a large children's hospital. So obviously, we had some resources that not every facility is going to have when it comes to taking care of children. Things like child life specialists, therapy dogs, videos that were made that, the parent could easily get online and click and see an actual, video walkthrough tour of the hospital. Those things are super helpful. If you're in a facility, maybe it's an ambulatory surgery center that doesn't have those kind of resources, still, find out in your preoperative phone calls or work with your clinics to talk about preparing the child for surgery. Bring your favorite video. If you're an adolescent teenage boy who spends all day playing video games, like bring that with you so that you can distract yourself from everything going on to play your game. Bring your phone, talk to your friends on your phone, when you're waiting for surgery, because, a lot of times it's a 2-hour plus wait time, depending on where you're at. So, maybe it's, if you're younger, it's bring your teddy bear, bring your favorite thing, bring something to play with, any comfort item, distraction item.
Yeah.
Make the parents part of it if you're in a facility that doesn't have iPads or virtual reality or games to give to the patients.
Speaking of the adult caregiver, does their state of mind impact the child's anxiety?
Oh, absolutely. Children feed off of the anxiety of their parents. So if you have a super high anxiety parent, mom or dad who, is crying or is already upset, the kid's going to think something is seriously wrong. And, as nurses, we walk in the room, we get a really good feel in the peds world of, what's going on with the family. And I've had some very, very stoic parents before who are just rock stars until the minute that child is out of their sight, and then they just break down. So, parents need support too. And it's okay to make sure that, if it's possible for them to go back for induction, that's a great opportunity. But you have to consider, is it going to help the child's induction, or is it going to make it more anxiety ridden? So you really learn to read parents. And often, that anxiety just comes from the unknown, the fear of the unknown and what's going to happen. So, it's those nursing 101 things, giving time frames, introducing yourself, building that trust ahead of time. We rely really heavily on our preoperative nurses to build that rapport at the beginning and make sure the patients are comfortable. We know they're hungry, we know they're tired and they're stressed, and so are the parents. So working together as a team, making sure that every person that goes in and talks to that patient is saying, the nurse is going to be here in this time frame. This is what you can expect. Otherwise, every time someone walks in that room, the kid's going to be thinking, oh, is it now? And it's not. Oh, is it now? So just think of that roller coaster of anxiety. So really describing what's going to happen.
Well, so speaking of the adult caregiver accompanying especially again, those little ones into the OR through induction, are you accustomed to a policy that allows that? Is it kind of left up to the nurse? What are you accustomed to there?
It can be either way. Usually there is an organization policy and procedure around that. Obviously, our anesthesia professionals are the go-to for that decision. They're responsible for that child's airway, for that child's safety, for a safe induction to general anesthesia. So it's a collaboration. It's not a one person decides, because the nurse should also feel free to speak up and say, I've spent, some time with that family in the room, and I just really don't think that it's going to be helpful for this family member to come back. So having that trust within your team is really important too, where you can speak up and say, ugh. You also want to make sure that if you are taking a parent back for induction, you need to have a team member available to walk them out. Because like I said, they could have looked as stoic as possible ahead of time, and they could drop the minute that child's under anesthesia. So making sure you have an extra person that can walk that family member out, answer any questions about what they saw, what they heard, because it's very scary for them as well. And the last thing you want to do as the nurse is to leave the bedside during induction.
Right. What other tips would you have for building rapport with the child to gain their trust in the preoperative area, right? We're at pre-op, we're ready to go. There may not be a lot of time, right? Sometimes that moves quick. What have you done, Tammy?
It's like I said, I normally would walk into the room and immediately talk to the parents, kind of get a feel, introduce myself, play off of their interactions, and then introduce myself to the child, get down eye level, don't stand over them. And don't take for granted that they have autonomy over their body. So don't just go to listen to their heart and lung. Tell them what you're doing. If you can provide those choices. Don't just do it yourself and make them feel out of control any more than they already are. So talking them through it, I'm going to take a quick listen to your heart and lungs. If it's a younger child, you may, have an extra stethoscope in the room, say, well, I'm doing this. Why don't you listen to mommy's, chest? Or why don't you do this? Or that playtime ahead of time where they can actually touch an IV catheter, see that it's not a needle that stays in their skin, that it's something really floppy. If they can put bandages on their stuffed animal like they're going to wake up with, that's really helpful too. Then with your older kids, it's really just, asking them, would you like that caregiver in the room while we talk about this? They're very conscientious of their privacy and their autonomy. So, just really understanding where they're at, giving those acceptable choices, in building that trust as much as you can with, sometimes 10-minute interaction. And then the words you say matter. You don't want to leave a parent saying, I'll take care of your kid. You want to say, I'm going to provide excellent care to your child. I'm going to take care of them like they were my own. We have an excellent team here. Giving that information to build that confidence, tell them when you're going to hear from me. I've been at facilities where it was hourly phone calls, or if it's doable, say as soon as that we're safely under anesthesia and we're getting started with surgery, I'm going to call you and let you know. It's just overemphasizing that communication. Don't assume they have any idea what's happening, how long it's going to take. And I think really important too is remembering that parents remember nothing that the OR nurse told them. Your fight or flight, those fight or flight instincts are just rapid fire, and they're not going to remember it. So you have to repeat yourself. You have to follow through. If you say you're going to do something, do it. And then equally important is if they do bring that stuffed animal back to surgery, as a comfort item, don't throw it away. Make sure that you put that back on the bed or have someone walk it out to mom and dad, because there's nothing more traumatic than not having that same comfort item when they wake up.
Well, I tell you what, I hear your point around the medical terminology that parents might not hear and remember all the words, but they do, to your very point, remember how you made them feel, or more importantly, how you made their child feel. Yeah. And I absolutely love the tactile, right, with those younger kids, the talking through and allowing autonomy for those older kids. Again, a lot of us have probably been on that other side. And I know when I want a nurse like you, Tammy, that gets down to that eye level, all of the things that you talked about. So that was so well put. What about the physical environment? Have you seen any cool ways that people, maybe they've put artwork up, allowed the children to create artwork? What have you seen to just make that physical environment home?
Oh, absolutely. Like I said, some places have child life specialists who are just absolute incredible members of the perioperative team. But even if you don't, you can maybe have a preoperative nurse that brings back a mask that they're going to go sleep with. Let them decorate it. Let them put stickers on it. Make it not scary. Let them practice breathing in it. I've seen some really cool light covers, because if you imagine you're just laying flat on your back looking up, maybe it's a cool just, light cover or a picture painted on the wall that they can focus on. It could be, allowing the surgical team to wear cool hats. Like in peds environments, you're often going to see, cartoon characters for hats. A lot of places have hats for kids that are colorful, or let them pick, what they're going to wear, what it's going to look like, what color their socks are, things like that. There's also, like I said, iPads, games, different things like that. Just something. It's that distraction, something to focus on, something that is relatable for their age and takes away from, like I said, just the faces staring down at them or the lights shining down on them and all of those sounds.
Yeah. Yeah. It's making me think about a location I worked in. It was a large academic medical center, and peds was a separate wing, but it wasn't its own hospital. And in the peds operating hallway, I think there were 7 ORs. And one of our pediatric surgeons' wives was an artist. And so she made this incredible mural that kids would comment on every time you took them back. Parents would. So again, it was just this atmosphere. Even as a nurse, when I would float down there, we're all kids at heart. So this is great. I just feel better being down here. And I think those things matter, is what I'm hearing from you.
Even just fun Band-Aids, like the little things. You don't have to have all of the resources in the world to just put those little touches on, or put an extra Band-Aid on the stuffed animal, that perfectly matches where their, bandage is going to be. There's just so much you can do. And I think it's also important to remember, like I said, if they're laying back what they're seeing, you have to be very mindful in a pediatric surgery environment to limit noises, make it quiet. A lot of places have what's called one voice, where they really designate one team member to be the person talking to the child. And that could be the parent too, if they're coming back. You don't want, the surgeon walking in the room during induction and, hey, just starting their conversation. So creating that environment where, it's, why don't you wait outside of the room until we're completely asleep? Sometimes it's even just the scrub tech over in the corner, arranging their back table. That is terrifying to a child, because all they see are instruments moving, and who knows what scenes from a movie they're seeing in their head. Like, what are they doing over there? And that's what they want to know is, what's that person doing? Who are you? Why are you doing that? What's that sound? So as much as possible, clear the room. Make it. If the parent's back, the parent, the nurse, and the anesthesia provider really focus on who's talking, who's the one communicating with the child. Don't have a lot of people touching and moving, and, just coordinate your efforts so that way it's very low stimuli, that they go to sleep more calm. In researching for my clinical issues column about pediatric anxiety, one of the interesting things I came across was crying in children actually can block the airway. So when you're talking about a mask induction, blowing air through the mouth and nose, like if they have been crying hysterically, it can really mess with their anesthesia experience. And if they have a really horrible induction, chances are they're going to have more pain after surgery. They can experience emergence delirium. And there's even studies that show that after they get home in the weeks following surgery, they have nightmares. So it absolutely matters that you're thinking about these things and how you can make it as smooth of an experience as possible.
Well, it's obviously an art to be a pediatric nurse, and you can tell that you have really perfected that art over the years, Tammy. I want to take us to the tonsillectomy went great. The procedure went well. And we're in the post-op area. Again, I know from my experience, the children don't handle that pain very well, right? So how do you help manage that child anxiety with the post-operative pain, literally in that post-operative room right after surgery?
It's actually funny because kids handle tonsillectomy pain much better than adults do.
It's true.
But that being said, if you have prepared them adequately ahead of time and told, you don't want to say, oh, it's not going to hurt, it's fine, you won't feel a thing. You have lied to them. you can tell them when you wake up, you might be feeling pain. If you do, I want you to tell me. And then I can immediately give you medicine. Don't be afraid to tell me about your pain. Here's how we're going to ask you about that pain. Show them the FACES scale, getting that caregiver back as soon as possible. That being said, it's really important to educate those caregivers, because in the emergence in the postoperative period, you don't want a caregiver running in and just stimulating the child. That can cause a lot of problems too. But you have to acknowledge their fear as well and say, we're going to let you come in and sit at bedside. This is what I need you to do. This is what I need you not to do. This is what you're going to see. But just educating ahead of time and then reinforcing throughout. Don't expect that they remember that. There's also some cultural differences. There are some children that culturally, they are very, very stoic, and they don't tell you that they're hurting. They don't tell you that they're scared. You can kind of tell by looking at them, but they're raised in a way where they're not verbalizing those things. So acknowledging that pain looks very different to different children. Sometimes you can just tell by their vital signs. Sometimes you can tell by, the outward. We also know that teenage girls wake up very hysterical and teenage boys wake up fighting. So just being prepared for those things, having that strong team in place to be able to respond quickly. And then, like I said, addressing that pain as soon as possible in a predictable way. It really matters.
You brought back memories of the first time I helped wake up an adolescent male.
Yeah. They just wake up fighting. I don't know.
It's true. That testosterone's starting to build up, huh?
Yeah.
Well, Tammy, if you were to give any final words of advice for a perioperative nurse on how to effectively support children with experienced anxiety before surgery, anything we left out, what would you say?
It's just the same, I think, with any kind of nursing. Is there's no one size fits all. You can go into it with a really firm, strong knowledge of age and developmental stages. You also have to adapt. So I think it's just so important to reinforce, talk to the patient, ask them what's important to them, talk to the parents, ask, how does your child like to be, informed of this? Those preoperative phone calls are so important. The work that the pre-op nurse does is so important. Talking to as a team, getting prepared so they're not having to repeat the same things. I've had experiences with autistic children who it's the mom has said he does not like it when someone does this, and that doesn't get passed on, and the next person walks in the room and does the exact same thing. That breaks trust. So it's all about trust. It's about safety. It's about finding out what is meaningful to your patient and then communicating the appropriate way. And then if you make a mistake, apologize, own up to it. Now we're dealing in healthcare with, a lot of diversity and equality, like using the right language, making it an open, caring environment where everyone is supported. Those things are very, very important. So in pediatric world, it's all about trust, and including that family-centered care, including the caregiver and the patient in the decision-making.
Tammy, thanks for the time today. Appreciate you sharing your experience. I think we all learned something about how to care for a pediatric patient. For those of you out there that might also be caring for pediatric patients, leave some tips in the comments below. Until next time, we'll see you on Periop Talk.